when it comes to infectious disease, it's not just one person that we're talking about here. I mean, this has been the history of public health.
What's up, ladies and gentlemen, boys and girls around the world? I would like to welcome you back to the Real Talk with Zuby podcast. On today's episode, we have got on Dr. Dan Wilson. He is a molecular biologist and host of the YouTube channel Debunk the Funk. So welcome to the show, man.
Hey, Zuby, what's going on?
Yeah, I'm all good, man. I'm all good. I'm glad that we're finally having this conversation. I know it's long overdue. We've had a lot of back and forths over the last couple of years during the whole pandemic era. We definitely don't see eye to eye on a lot of various things. And we were meant to have this conversation, I think, last year, but I've been traveling like crazy, and it just keeps going back and forth. So I'm glad that we're finally making it happen. How's everything on your end?
It's all good. I'm busy too. I got my second kid now. It's 4 months old and keeping us busy. But yeah, I mean, we know we don't see eye to eye on the pandemic, but point of your show is to have conversations, and let's just talk about it and see if we can come to some understanding.
Absolutely, man. And congrats on the new edition. It genuinely makes me happy to hear that.
Thanks.
Awesome, man. Well, I've done a brief intro there, man, but for those who are not familiar with you and your work, just please give a little bit of an introduction and background.
Yeah, sure. So my background is I have a PhD in biological sciences. I got that from Carnegie Mellon University. From there, I went on into industry because I don't know if you know much about academia, but with my wife and I being about to have our first child, I wasn't going to continue in that. So I went into industry, we moved, and now I work at Janssen. I'm a senior associate scientist there. And in my spare time, I just do a YouTube channel because personally, I used to believe in a lot of conspiracy theories when I was younger. And science helped kind of pull me out of that thinking. And so I thought, what better way to still have fun learning by challenging bad science and also just giving myself a hobby to do in that realm. So I started a YouTube channel, and yeah, that's about it.
Okay, interesting, man. There's a term that you use there, which I know you use a lot, which is bad science. So tell us what bad science is.
So when I cover bad science, usually it's either poorly communicated science. So it could be a good paper that is getting misinterpreted or getting spun in a way that does not represent what the findings actually are. Or it could be a bad paper where maybe the authors used poor methods. They maybe they did some fabrication of data. Maybe they published it in a predatory journal and the work is just not up to par, and they're making bold claims with it that can't be backed up by their actual findings, nor can they be backed up by the rest of the scientific community's findings when they actually challenge those data and try to reproduce them, interrogate them, build upon them, whatever. So from that bad science, you get a lot of misunderstanding of science. And I think that's generally a big problem around the world. Science is a difficult field. Science is generally a difficult topic to understand for a lot of people. And the mainstream media often gets it wrong in their headlines or in their short segments on the news. And they either get it wrong or they don't dive into it enough so that people actually understand it, right? And so it's on the job of scientists to actually communicate and correct that. But a lot of scientists aren't trained to do it, don't care to do it, and are too busy to do it. So yeah, bad science can be all of those things that scientists ultimately have the responsibility of correcting.
Understood. Okay, so as I've already said at the beginning of the conversation, we've had a lot of back and forths, and on Twitter, I wouldn't say they've generally been the most friendly. My goal of this podcast is not necessarily to fight or debate, and I absolutely never insult my guests or resort to ad hominem or anything like that. You're the guest on my show, and I treat it as such as my host. I want to say up front that I am open to learning. I am open to having my mind changed. I think that there are probably things that we are both dug in at this point to the extent that a mind change might be unlikely, but there are going to be thousands of people who listen to this. So I'm just open to have a conversation and see where it goes, see where it leads, see what our points of disagreement are, see what our points of agreement are, see how we think, how we reach our conclusions, and let the chips fall where they may. So I guess the first question I'm going to ask you about this is, obviously you responded over the, I don't know the first time we had any interaction online. It was maybe perhaps late 2020 or sometime in 2021 for sure. But I've had various tweets that have gone out there, which I know that you have specifically taken issue with. I think you've taken issue with a lot of my communication during the time around the pandemic. And we certainly were not seeing eye to eye on the risk and about lockdowns and masks and mandates and vax mandates and all of that stuff. So let's maybe just start with an open question of what do you, okay, what's the greatest thing that you have taken issue with in terms of my communication, or what is the biggest thing that you think that I'm getting or have gotten wrong throughout this?
So I guess my biggest issue with things that you've said is you have put out the sentiment that COVID vaccines, specifically mRNA vaccines, are killing thousands of people. And you're giving the impression that they're dangerous and that they shouldn't be taken. And that is, I guess, the biggest issue that I have with your communication. And I'd be curious to see what you have seen that brings you to that conclusion.
Okay, that's interesting. All right. I mean, I think there were many criticisms prior to this in terms of the lockdowns and things like that.
We can get to that
Sure.
too, yeah.
Yeah, sure. Okay. I'm happy to start with the shots if that's where you want to start. So, and by the way, I'm not going to do any I don't do politician answers. So, but in the course of some of my answers, I might ask you questions so that I know that we're coming from the same place in terms of statistics and numbers and things like that. And if there's something that needs to be corrected or we're coming from different sources, then it can be clarified. So I'm going to lay out what my position is. I think that you've partly got it right. I would say that I know for sure I have never told anyone not to take the shot. My position has primarily been throughout the thing, you can, from beginning of 2020, has been opposed to the mandates, opposed to the coercion, and opposed to the lies and just the dishonesty, in my opinion, coming from the media, coming from politicians, coming from so-called public health experts, not just, I mean, in different countries. I'm from the UK, but I think wherever you go, the messaging was largely similar. So my personal viewpoint is based off of, firstly, just starting out with how, you know what, actually, I think a good place to start would just be how dangerous / deadly we both think that COVID itself is, because I think that perhaps we don't see eye to eye on that. And as a result, everything that follows, we are missing each other on. So my viewpoint, well, I mean, not my viewpoint. I mean, look, I actually, before this conversation, to make sure that I'm not like just sort of running things off of my feelings, I wanted to check the infection fatality rate by different age groups. So the numbers that I have seen, I have got a link to this, but based on the numbers that I've seen, for the various age groups, the median infection fatality rates that I've got for age 0 to 19 years old is 0.0003. For 20 to 29, 0.002%. From 30 to 39, I've got 0.11%. From 40 to 49, I've got 0.035%. From 50 to 59, I've got 0.123%. And from 60 to 69, I've got 0.506%. And then from age 70 upwards, it increases over 1%. Do those, firstly, I want to say, do those numbers align with your own sources?
So is that the infection fatality rate or is that the case fatality rate?
I have that as the IFR, the infection fatality rate.
Okay. So I would look at case fatality rate if I was going to look at any number like that. But to be fair, those numbers sound like, I'll just agree, sure, they sound in the ballpark of what the case
Okay.
fatality rate would be. But case fatality
We
rate is a better metric to look at for that. But
okay.
um, were you going to say something else, or
I was going to just say, would it be fair to say for people aged under 70, under 1%?
uh, pre-vaccine um, aged under it was around 1% non-age adjusted. So pre-vaccine. So below a certain age group, it was going to be below 1%. Yeah.
Okay. Okay. All right. Cool. I just want to make sure that we're aligned on that, because my a lot of my thinking, not all of it, but a lot of it is based off of the fact that I do not believe that for the vast majority of the population that COVID is a serious threat or ever was. I've never made the claim that for elderly people or that for people with various comorbidities and so on, that it isn't. And I know that there's exceptions to this. I know that there have been young people who have had a bad and a rough time with it. I'm fully aware of that. I don't think I've ever claimed that isn't the case. But when I look at the overall response to it, I do not believe that the response, I'm talking about lockdowns, I'm talking about the various types of mandates, the rules and restrictions implemented in various countries, the coercion, the segregation, the discrimination, all of the stuff that came out of it, and all of the long term, all of the ongoing effects that that's having in terms of the economy, in terms of civil liberties, in terms of people's mental and physical well being, in terms of inflation, and so on. I do not believe that it made sense. I would go as far as saying I believe that the impact of the policies has been and will be worse, in my opinion, than the impact of the disease itself. I also think that many of the policies themselves did not make sense. I know that you're a science guy, you're all about science. I think that many of the policies that were undertaken around the world were illogical, let alone like they didn't make any sense in terms of science. So if you're willing to, if you're able to change my mind on some of those, I'm happy to give examples. If you feel differently on those, I'm not going to make you defend every stupid policy. If we want to go through some of them, we can see the ones that you think make sense and the ones that perhaps you don't think do. But I'm giving you my overall perspective. My perspective is generally one of choice. So if someone, I've never in my life told anyone to, I've never even asked anyone their vax status. I've never yelled at anyone for wearing a mask or not wearing a mask, for taking a shot or not taking a shot. My stance has always been this should be up to people. If individuals do their own risk calculation for themselves and their family, and they think that it's best to stay home, or they think it's best to close down their business, or they think it's best to wear a mask or wear 2 masks or take 0 shots, 1 shot, 5 shots, however many. I've never cared about any of that stuff before with any other illness and with most health things in general. I think it's up to individuals. That's been my stance. My stance has been anti-mandate. You could call it anti-mandate. You could call it anti-lockdown. I would simply say that it's pro-freedom, pro-civil liberties, and it's also just pro-transparency of information. One of my biggest beefs throughout this whole thing has been something you touched on earlier, which is about the communication. And I think that the communication has been awful. And I think that the part of the reason it's been awful has been because I don't even want to go too deep, because I don't want to just like throw tons of stuff out here. But yeah, I do think that there are ulterior motives. I don't think that the people who were rolling all of this stuff out necessarily had the best intentions of the entire population in mind. And I'm not some super deep conspiracy theorist. I'm not here like saying that I think, the shots are turning people magnetic, or 5G's out here going to, kill everyone or everything like that. I just don't think that in a remotely free society, you should be forcing injections on people, or you should be forcing masks on people, let alone children. But I don't think adults either. And that has generally been my perspective. I don't think that the government's even had a right to do many of the things that they have done. So I've given you a lot there. You're
Yeah,
welcome to take that away. I'll allow you to respond. Yeah.
that's a lot. So let's I think first we'll start back at how dangerous is COVID? How much a threat was it, and how much damage did it cause? So I think looking at an IFR, an infection fatality rate, is going to give you a significantly limited perspective on how much of a threat it is, because a infectious disease with a low fatality rate but high infectious rate can still cause a lot of damage. And remember that death is not the only bad outcome that we want to prevent in people when it comes to a new virus like SARS-CoV-2. You could die from it. You could also be hospitalized. You could be admitted to the ICU. You could end up with long COVID. None of those things are things that people want. And those are all things that we want to prevent in terms of public health, right? The more of those things we prevent, the more people live, the better the economy can do with more living, working people, et cetera, et cetera. So COVID did kill millions of people around the world. The majority of those people were older, but it did still have a significant effect on younger people. And when it comes to those younger ages and all ages, really, it's not so much of a question of what's the absolute risk that COVID poses to me. It's what option am I better off taking, right? Like, am I better off with the vaccine or without the vaccine? Am I better off wearing a mask in certain situations or better off not doing so? And we can interrogate those questions with science and gather data to answer those questions. And so when it comes to things like vaccines, in all age groups, it's been shown that you are better off per capita being vaccinated than not being vaccinated for all of those bad outcomes. And I guess maybe the best example of this is that in Korea, for example, there's a really big data set from Korea. There was one study that looked at the adverse events and harmful effects of vaccines in a population of about 42 million people. I may be getting that number slightly wrong, but it was in that ballpark. And they looked at even looked at deaths that can be associated with the mRNA vaccines. And when it came to people 18 and under, 0 people died that they could associate with the vaccine. However, in that same country, out of fewer COVID infections, so fewer than the 42 million vaccinees that I just talked about, out of a cohort that's smaller than that, there were about 46 deaths in age 18 and under. And
is this over? So just to be clear, what time period is this over? Is this over the entire time period? The 2.5, 3 years?
These time periods were similar time periods.
Okay.
I'd have to look at the papers to get you the exact times, and I can definitely do that for you. But they were similar time periods. And there were about 46 deaths in people aged 18 and under in that country from COVID. And the biggest risk factor for them was being not vaccinated. So you see a data set like that, and that can give you a big picture perspective. But then we can also drill down to individual cohorts. We can do more detailed studies looking at different groups from all over the world. We can look at different outcomes.
Sorry to jump in there. Do you know what, out of those, let's say the 46 young people who you said died, was that of COVID directly from it?
Mm-hmm. Yep.
Yeah. Do you know what percentage of those had comorbidities versus not, just to be clear?
So the biggest risk factor was being unvaccinated. More of them were unvaccinated than had comorbidities.
More of them were unvaccinated than had comorbidities. Okay, that makes sense. I understand.
Mm-hmm. Yeah. So when we look at all these different studies from around the world, we can consistently see that if you're vaccinated, you are less likely to suffer severe outcomes from COVID. And that's really the goal, right? You don't want to end up in the hospital. You don't want to end up with debilitating disease. And it makes sense that you can prevent all those things with a vaccine that's giving you a piece of the virus, essentially. It's introducing your body to the virus, letting your body like treat it as a punching bag, learn from it, get like tactical information on the enemy, and then when it sees the enemy, it knows what to do. So again, we can see that for all age groups, and just scrolling down your page on Twitter or seeing the kinds of things you say about COVID vaccines, you would, as a reader, I get the impression that you are saying that we don't need them and they're harmful. Like, it's
Okay,
not, it's not as,
I don't think, I feel like that's a bit of a straw man of my position,
okay,
to be honest.
So yeah, go ahead.
Okay, no, I was going to say, like, so I'm not going to push back on all of these numbers. I haven't looked at the South Korean study and so on. I would make a couple of points on it. I mean, the first one that I would say is, look, 46 young people dying. What's that age group, by the way? That 46?
18 and under.
18 and under. Okay.
But in America, we had about,
I'd love to see wider numbers. Oh yeah, what was it in America?
Sorry, in America, it was about 2,000 kids throughout the whole pandemic, 18 and under.
Okay, so 2,000 over a 3-year period. Is that fair to say?
Mm-hmm.
Yeah.
Most unvaccinated. Yeah.
Okay. But also mostly with comorbidities, right?
No.
Is that fair to say? Mostly not with comorbidities?
Right. So there was a study that looked at hospitalization and ICU admission rates in children, COVID cases. And it found that about 30% did not have comorbidities. Am I still with you? Your screen's frozen a little bit.
Okay, sorry.
You back?
I don't know what happened there. Yeah, I'm back. Carry on.
Okay. Right. I was saying that about 30% of the kids that were studied had no comorbidities. That's 30%. But 90% of the kids admitted to the ICU were unvaccinated. So, you can't always predict who is going to be at risk based on pre-existing conditions. And that's the important thing when it comes to public health. Like, you don't know necessarily who's vulnerable. There have been plenty of healthy people who would consider themselves healthy, be seen as healthy, who have suffered of COVID and who have died of COVID. And if that suffering is preventable, then it's worth preventing that suffering with the tools that we have at our disposal.
Okay, that's interesting. I mean, directions to go here. So I think, okay, what's the first point I'd like to bring up here? I think the first point I want to bring up is, I think that throughout this entire situation, one of the issues that I've certainly had with it is this is a real multivariate situation. And the sort of simplification that's been done through all the communication from the public health officials, from the politicians, people pushing policies and so on, and from the media, even in terms of the way many of the statistics are done, has simply been unvaccinated versus vaccinated, which, if you're talking about something as multivariate as health outcomes, is ridiculous to me, especially when you consider that the vast majority of people at least vast majority of adults in our countries who died were overweight, obese. I think a ridiculous proportion had vitamin D deficiency. So there are other factors that go into this. So I think even the simplification of just making it as vaccinated versus unvaccinated, not only did it lead to a lot of the divisive stuff, which obviously I take issue with, but I think it's also not, I just don't think it's an honest, and again, if we're going to talk science, I don't think it's a very scientific approach to just say, okay, well, we've got a massively overweight and obese population, and the vast majority of the healthy people, whether they're vaxxed, unvaxxed, or whatever, they're doing fine, but actually obesity is a gigantic risk factor to this thing. As far as I'm aware, in the UK and in the US, I'm not sure if at any point it was suggested that people supplement with vitamin D. I don't know if it was I certainly don't know if it was recommended at any point that people get their butt to the gym and they lose some weight and they take care of their nutrition and they do various other things that they can to boost immunity. It all just came down to mask, vax. And to me, as someone who is a health advocate, This is not a holistic health approach at all. And so this is where I think some of the so-called quote unquote conspiratorial thinking comes, because it's like, well, if this thing is simply just about health, there are a lot of questions here. Why are you shutting down gyms? Why are you shutting down public parks? Why are you shutting down beaches? Why are you telling people not to go outside and not to get that vitamin D? Why are you telling people just to put on a mask and take the vax, but you're not encouraging them to lose weight? You've got people who are 50, 100, 200 pounds overweight, and there's no messaging at all, even suggesting them. And again, this is like over a long period of time, suggesting, hey, these are other things that you can do to improve your health. So what are your thoughts? What are your thoughts on that?
Yeah, so I'd push back on a lot of things there. So I wrote down comorbidities. So let me just clarify that. So I think that a lot of people hear comorbidities and they think things like diabetes, obesity, um, asthma, things like that. And when you hear that people who died of COVID-19 on average had like 3 to 4 comorbidities, I mean, that's been said a lot, like on Joe Rogan and things like that. But that's not really, I think that misses what a comorbidity is when it comes to a death certificate. So a comorbidity on a death certificate is anything that contributed to the death. So a typical COVID-19 death certificate might look something like respiratory failure due to pneumonia due to COVID-19. That's at least 2 comorbidities contributing to COVID-19, but they were caused by COVID. So the actual numbers on how many people were obese or had diabetes might be inflated if you are thinking about comorbidities in just that, in a way that says that they're just those things, right? So I could get you the numbers from America on that breakdown, how many people died from COVID who were obese, had diabetes, et cetera, et cetera.
Okay.
It might not be.
Just to jump in there, the
Yeah.
number that I remember seeing, which I've just looked up very quickly, this is the thing that pops up first is from 2021. Actually, I've seen something from 2022, and it's saying that over 75% of the people who were hospitalized were overweight or obese, and that's coming from the USA. That's from the NIH and the CDC.
Yeah,
I know that. I know that 70% of the American population is overweight and obese. So that's not.
Yeah.
that probably doesn't help.
But if you say if you add overweight to obesity, then that's broadening it a lot. But yeah, that's just one thing. You know, maybe comorbidities might be reframed a little bit if you look at like what's actually classified as a comorbidity upon death. But then you also said vitamin D. There hasn't been any data suggesting that vitamin D supplements help fight COVID. There's a common misconception that there's a stat that's also commonly reported that most people who are hospitalized with COVID, when they test them, they have low vitamin D levels. And that is normally a result of COVID itself. There's an analogy here where it's like if you're a firefighter and you go to a fire and you're like, holy shit, there's ash and smoke everywhere. Let me get rid of the smoke and the ash and that'll solve the fire. Like, no, the fire is causing the smoke and the ash. And in this case, the smoke and the ash is a vitamin D deficiency because your body is fighting off a virus. You are getting into a state where you can become vitamin D deficient. And even in that case, there have been studies looking at, can we treat COVID using vitamin D? Like once someone comes into the hospital and they're vitamin D deficient and they're hypoxic, can you treat them with vitamin D? And you can't, it doesn't work. Like doctors have tried it because doctors honestly want their patients
just to jump in here though. I mean, isn't it well known, isn't it scientifically established that vitamin D in general is very good for your immune system? I mean, the fact that COVID itself that the virus itself can deplete your vitamin D levels, that would suggest that as a preventive measure, it would be important to have those topped up either just from natural sunlight or from some type of supplementation. Or am I missing something there?
Well, so if that were true, then if we give it back while your body's fighting COVID, then that should help, but it doesn't. And
Well, I
then,
think there's
but
prevention
also,
versus cure are different. No, I mean, if
so
you
yeah,
gave someone a COVID, okay. I was going to say, I mean, you're obviously very pro-vax, and I'm saying, I'm surely if you gave someone the vax once they'd already succumbed to it and been hospitalized, would that? I doubt that would necessarily help them, even assuming that the vax assuming the vax is effective from your position.
yeah,
I
no,
don't know. Yeah,
yeah, that's not how vaccines work. And
yeah, yeah.
you're right, and I see what you're trying to say,
Okay.
but also, if you there have been studies that look at what happens if you supplement with vitamin D. Does it help protect you against respiratory diseases? And the consensus is that no, it really doesn't. And the reason is that most people aren't actually very deficient in vitamin D to the point where it can be, detrimental. A lot of times when if you're not malnourished, then you shouldn't need vitamin D. And very few people, even if you're obese and you're not eating well, you're probably not malnourished, right? There's a difference between not
Is
eating
it?
well
Is it?
and not.
I thought vitamin D deficiency is actually really common, especially in
not
certain climates and areas.
so maybe in climates where, like in the north, like in northern Europe, it can be more of a
Mhm.
problem. But it's not really so common that it's not common to the point where it's going to put you at risk of infectious diseases. And that has been shown with these vitamin supplementation studies, where there are actual randomized controlled trials where people take vitamin D or don't, and the outcomes with respiratory illnesses are not significantly different. So, um, yeah, I'm all for eating
And
great, being healthy,
okay,
and
yeah.
that the advice on that has not changed from doctors in a really long time. Doctors have always said, eat well, get exercise. And like, I hear your frustration because a lot of America does not follow good health habits. And yes, that can put them at risk of worse outcomes for infectious disease or just worse outcomes for health later in life. Um, and like with your thing, I think it's great that you try to encourage people to work out and get fit and eat healthy. That's fantastic. That's great. But like you also don't have to give this impression that vaccines are not necessary or dangerous, or that they're dangerous. Um,
I don't look. I'll be honest. I mean, I think I don't want to. What you're saying there seems a little accusatory. So I don't want to do the same back. But I don't think that. I feel like what you're saying there is sort of lumping me. I know you use I've watched quite a lot of your YouTube videos actually, and I noticed that you call a lot of people anti-vaxxers, you call a lot of
mhm.
people anti-science. I would say that I think you overuse that term to the point that you're kind of lumping in people who are genuinely against all vaccines with people who just have certain questions or who are skeptical or who just chose not to get this one or who have hesitations and things like that around it, which from a communication standpoint, I don't think it's very effective. And I know that I think a lot of genuine anti-vaxxers have actually been created over the last few years, partly because of the overuse of the term and just some of the communication. I think when you kind of go around calling every single person who's skeptical an anti-vaxxer and just dismissing them, in my personal opinion, number one, I don't think it changes minds. But I think in the long term, when you look at the whole picture, I think it's actually quite likely to create more of them, because if people are just labeled instead of someone explaining a position, then I don't know. I think it causes more skepticism and it causes people to dig in more, and it creates more of a us versus them mentality. So I know I definitely through my communication, like I definitely have not been and I'm not pro COVID vax, and I never have been, but I'm also not opposed to it. I know I'd say probably most people I know did take it. And I didn't tell any of them not to, or discourage them, or attack them, or insult them, or anything like that. No, I wouldn't do that. But also, I'm very vehemently opposed to mandates. And I know, based on some of your older tweets, I don't know if you still hold this position, but I remember you saying something about being pro-vax but anti-mandate doesn't make sense. You didn't say this to me, but it was in response to somebody else. And I don't understand that position. I think that I can dig up the tweet if you don't remember it. But it was someone who was saying that they're very pro-vax, but they're anti-mandate. And you'd suggested that position doesn't make sense. Maybe you don't feel that way anymore, but
well,
that was something that, okay, go ahead.
No, sure. I mean, well, first I want to just talk about the anti-vax thing. I mean, so in my view, someone who is an anti-vaxxer is someone who uses their platform to spread anti-vaccine misinformation, whether that's about childhood vaccines or about COVID vaccines. That's my view of that. And
what does that mean, though? Sorry, that's such a, at this point, misinformation and disinformation and anti-vax misinformation. Right. These are such egregious terms because they've been so overly utilized and weaponized by the media, by social media platforms, by YouTube, by certain politicians and bureaucrats around the world, where they just started calling everything and everyone who was not 100% on board with every policy and action an anti-vaxxer, and started calling everything a misinformation, despite the fact that, as I'm sure you will admit, if you're an honest man, they themselves have moved the goalposts a lot. They themselves moved the goalposts a lot throughout 2020 to 2023. And they themselves contradicted. I know science updates. I'm very aware of that. But at no point did they say, oh, we made a mistake, or we got this wrong, or okay, maybe these numbers are not what we thought they are. This is not what we predicted it is. They just kind of kept going as if it was still February 2020. So I would make the argument that the so-called public health experts and the mainstream media and many politicians up to the president himself, I would say that they spread a lot of misinformation about the vaccine, about lockdowns, about mandates, about the virus itself, and how deadly it is, and about what's going to happen to people who don't take the shot, or what's going to even happen to people who do take the shot. Joe Biden himself, I'm not saying he's but he is the president of the USA. He said, look, if you take these shots, you're not going to get the virus. You're not going to get it. He said that, right? Like, I know is misinformation. Yeah, right. That's my point. I'm like, that is misinformation, because
and Trump,
if you tell that to people, then exactly. I'm not even, to me, it's not a Democrat Republican thing, whatever. There's stuff that at this point Fauci says this, and then he says that, and so on. And sometimes people get things wrong. I have no problem with people getting things wrong and saying, oh, actually, you know what? I got that number. I got that number wrong, or I thought this was going to happen and it didn't, or I thought that this had a 99% effectiveness and it turned out to be 80%, or whatever it is. And at no point did they just didn't really update this for a long time, for a very long time. I mean, one thing that's annoying with the vaccine for me, or the vaccines, is obviously the mandates, and I do want to get into the mandates because that's a huge thing that I'm very opposed to. But it went from, look, if you take the shots, you're not going to get it and you're not going to spread it. That was how it started. I remember very clearly in late 2020, early 2021. That was the message. That was what you were telling hundreds of millions of people, billions of people potentially. And then it changed to, oh, it's super effective, but there's these rare breakthrough cases. And then it started getting to the stage where tons and tons of people who were vaccinated started to contract the virus and test positive and so on. And then it shifted to, okay, well, if you take the shot, it's to reduce hospitalization and death, which is a very different statement to, this is going to stop you getting the virus and prevent transmission. Like, that's a very different, that's a very, very different statement. And people obviously make decisions based on these statements. And these are coming out from the people who are supposed to be the experts, who are supposed to be the points of authority. And look, I don't know if they just got it wrong and then they got new information, or if they were just being dishonest from the beginning. I have a natural inclination to lean more towards the latter based on the wider picture. But even without assuming malice, the point is that they still spread misinformation. So just coming back around to what I'm saying, this is why I think the sort of misinformation and disinformation terms are a problem, because I think anyone who disagrees, right, there's going to be people who listen who right now who disagree with you, and they're going to be like, oh, yep, Dan Wilson is spreading misinformation and disinformation. I'm sure you've had that in your comments, people telling you you're spreading misinformation. I get people telling me I'm spreading. And it's just like, well, what does the term really mean? I generally try, especially on these podcasts, to not assume. I'm not assuming ill intention on your part. I know you're a father. I know you have children. I know you care about people. I'm not coming from the position of, oh, I think this guy, wants people to die, or he's just like on Big Pharma's payroll, whatever. Like I'm not assuming evil or ulterior motives on your part. But yeah, I don't want to ramble too. I don't want to ramble too long. But I genuinely wish over the past few years, regardless of people's individual positions, I wish there could have been a lot more of that. And I think part of the reason it got so contentious and unpleasant is because people were just so tribal that they were unwilling to say, okay, maybe this person is not an evil anti-vax conspiracy theorist who wants everybody to die, and my grandma to die and my children to die or whatever. Maybe they just have a different opinion, and the same the other way around.
Sure. Yeah. So when I say the term anti-vaccine misinformation, that's not implying that the mass media or the president doesn't spread misinformation. I'm just saying that if someone is spreading anti-vaccine misinformation, in other words, saying things like vaccines have killed 17 million people, or COVID vaccines are gene therapies, or all this stuff. That is anti-vaccine misinformation.
Is it? So, didn't some of the manufacturers themselves use the term gene therapy?
No. So they talked about how when mRNA vaccines were first, they were thinking about how to submit them to the FDA, there was no structure for the FDA to look at something, to review something or categorize mRNA vaccines, right? Because mRNA vaccines had not gone to market before COVID. So they were saying we can submit it as a gene therapy, as if it's a gene therapy, but it is not a gene therapy because it's not treating a genetic disease by correcting a genetic deficiency. So,
okay, fair enough.
So yeah, that's what I mean when I say misinformation.
And I don't think the shots have killed 17 million people. That sounds like a massive overestimate.
That's good. But there are people who do think that, and so when they say things like that, we just humans like to categorize things, and that is anti-vaccine misinformation to me. So but that's, again, that's not to say that the mainstream media can't spread misinformation. Like you said, Biden said, if you get COVID vaccines, you're not going to get COVID, you're not going to get sick. That was not true. Trump said that COVID vaccines saved, what did he say? He said 100 million American lives. I mean, that's not true. That's ridiculous. That's way too high. And the thing is that politicians and news media outlets, politicians want to make themselves look good, and news outlets want to sell stories. So politicians are going to embellish and stretch the truth or lie to make themselves look good, right? Trump had Operation Warp Speed, so of course he's going to say they saved 100 million lives. Look how great they are. And Biden, they were rolling out mostly during his presidency, so of course he's going to say, we're doing great, everything's fine. So, I don't trust them. I don't look to them as good sources. And same with mainstream media. They want to sell stories. They want to either scare you or give you or blow your mind with a headline. And so I don't take those sources of information seriously.
Okay. Can I ask a question?
Sure.
Just based on what you just said there. How come you don't seem to have as much smoke for them as you do for the independent individuals and podcasters and things like that who are out there actually having open conversations, perhaps conversations you disagree with and would like to rebut? But I would think that if we're talking about power dynamics and influence, the mainstream media, the pharmaceutical companies, the CDC, the Fauci's and his equivalents around the world, the presidents and prime ministers, the people who are actually setting all of these policies and who are pushing out all this information en masse and who have, billions and trillions to do it with, if they are, as you said, if they've told lies and that they themselves have spread misinformation and disinformation, why are you not as critical of them as you are of, I don't know, whether it's a Joe Rogan or it's a Brett Weinstein or it's perhaps myself or, independent people who are just honestly trying to work out what the heck is going on?
Right. So I do criticize them. I have criticized the CDC before. I've criticized the government's handling of lockdowns, multiple governments' handling of lockdowns. But maybe you don't see that as much, and it isn't as prevalent on my channel because I'm in this space where I'm combating anti-vaccine misinformation. I'm combating the kind of misinformation that would have sucked me in as a kid when I used to believe a ton of conspiracy theories, because I think it's egregious and harmful, especially when people like Joe Rogan, will host someone like Robert F. Kennedy Jr. and he'll say that he'll tell Joe Rogan that HIV doesn't cause AIDS, or there's a good case to be made that HIV doesn't cause AIDS. And Joe just sits there and nods his head like, yeah, wow, whoa, that's amazing. And I'm sitting there just thinking like, this is insane. This is like, how many people are going to believe this? And if a lot of people believe this is going to be super harmful. I mean,
oh, sorry. Let me not cut you off. Karen, finish.
No, I was just going to tell a story. I mean, and this might be a little bit of a tangent, but I brought that up because I feel strongly about it. My dad's side of my family is from a small country in Southern Africa called Eswatini, formerly known as Swaziland. And that is the most AIDS afflicted country in the world. My granny, who just passed away about a year or two ago, I didn't get to see her much since she lives so far away. And time is weird. So I don't remember exactly how long ago it was now, but she had a farm where she raised a lot of AIDS orphans. There were a lot of orphans whose parents died from HIV AIDS. And there were so many deaths there, partly because the president of South Africa at one time his name was Mbeki. He believed that the antiretroviral therapies used to keep people who are infected with HIV alive to like a normal lifespan were poison. He believed that. And so he didn't let a lot of citizens, or he didn't pay for the entry of antiretroviral therapy into South Africa. And as a result, there are a lot of AIDS cases now. And the reason he believed that is because of a virologist from, I don't remember the university. It was in California, one of the UCs. And I'm not going to name him, but a virologist who Joe mentioned, who Robert F. Kennedy Jr. mentioned in the book, who was pretty much single-handedly responsible for pushing the idea that HIV doesn't cause AIDS and that antiretroviral therapy are poison. And I mean, countless people have died from that. And I've seen the results of that. And so to have someone go on a podcast that is the most listened to podcast in the world and just say those things that are easily demonstrated as false, is really frustrating to me. And so that's where I choose to focus my time, in preventing people from falling down that same rabbit hole that I fell into once. So that's where I choose to put my efforts.
Okay. I understand that. Do you think that people should be censored? There was a lot of censorship going on over the last few years. Do you think that that is an appropriate course of action?
I think that social media has a responsibility to curate, or at least do something on their platforms, not just let things run wild. I mean, we can agree that certain things should not be allowed on social media, and we just disagree on where the line is. And I'm not going to pretend to know where that line should be, but I think something should be done. So do I agree with censorship? No. But I think that social media platforms can and should do what they think is right to not allow certain content on their platforms.
I mean, given the nature of science itself and the way that things change, there can be and there have been things which are considered, conspiracy theories, or which are very much against the scientific consensus at any moment in time, whether we're talking about this previous pandemic or we're talking about things further in the past, which people absolutely wanted to censor or do censor, and then they turn out to be the truth, or at least have some truth in them. So don't you think that's somewhat dangerous, to let the social media platforms decide what is, again, it comes back to the misinformation, disinformation thing, because there could be something that in April 2020, it was considered misinformation or disinformation or a conspiracy theory. And then 2 years later, it turns out to be true, or to have an element of truth to it. And there could be then something, we're always learning more. I think that's the biggest issue. There's a lot of issues I take with censorship, obviously. I mean, there's just the civil liberties aspect and the free speech aspect, but also from a scientific perspective and just human understanding, it's like, man, like it doesn't matter the subject. Everyone has their different opinions. Everyone has their different positions, perspectives, experiences, and so on. And one person's fact is another person's misinformation. One person's opinion is another person's disinformation. It's so messy that I'm personally of the opinion that what we are doing right now, this is the way to do it. So, Joe Rogan can have a podcast, or whoever it is. I know he's he's managed to build a massive podcast. He's got millions of listeners, but I think it's I think the sort of creeping authoritarianism and censorship is extremely concerning for a lot of reasons. I think you have to let people talk and have conversations. And there are people who have, there's all sorts of billions of people in this world who have all sorts of ideas that I disagree with, or things that I think are straight up silly, or just completely wrong, or even immoral, or whatever. And I'm very much of the opinion that, hey, they got to be allowed to speak, and you should also be, and it runs both ways, right? If I say something which you think is wrong, or you think is misleading people, or you think is potentially harmful, and then you can come back with your position, or you say something which I'm like, oh, actually, I think that that's objectionable because of XYZ, and I can have that conversation with you, and we can have that back and forth. I think that's the best way to do it. I know it's messy. I know it's frustrating. I know that there are people who are gullible in all various directions. But I don't see, besides sort of having this massively increasing censorship state, or censorship amongst tech companies, or whatever the case may be, I don't see the alternative. I'm not even here trying to, prosecute people who are saying that, who are saying that, the vaccine is 100% safe and effective, and you're not going to get COVID if you take it, or whatever. Like, I'm not trying to come after them. It's just like, I just think all the opinions and ideas have got to be able to float out there, and over the course of time, we get to the truth.
Sure, I see that perspective, but it's just, you know, to me, as a scientist, when I look at the scientific literature and I see that there is a clear answer, and then I see people with vested interest in that particular answer not being the answer, then making tons of money and gaining tons of influence and actively harming people in the process by going against that conclusion, then I see a problem with that. What action do we take?
Can I jump in?
We can debate
Sorry,
that,
sorry.
but
Okay.
but
Can I just take issue with the actively harming part? What do you mean by actively harming?
oh, so I mean, like when people actively are spreading ideas that, for example, that HIV doesn't cause AIDS, if they are convincing people of that, that's actively causing harm because those people are going to or could potentially die because of that information. We've seen that before. We've seen HIV, AIDS, you know, these activists back in the 90s, early 2000s, who were on these big campaigns against antiretroviral therapy. And I tell a story of a mom who was very active in that group, who was HIV positive. She refused to take antiretrovirals. She had her second child, her daughter, refusing to take antiretrovirals against her doctor's advice. She passed HIV on to her daughter, and a few years later, both her and her daughter died. And that was a preventable death. But she wholeheartedly believed that because people were spreading a message that benefited them, but was actively harming others. And like I said, I take issue with that. I don't know what the solution is in this internet landscape we have. How exactly do we prevent that from happening? But I think that we should try to do something. And my effort of doing something is to put information out on my channel any way I can, no matter how big my channel is. Just that's how I deal with that frustration from seeing that.
And by the way, Dan, I want to say I do respect that. By the way, I respect the fact that you're even willing to have this conversation. Part of the reason why I know I was meant to have this with you, we were meant to do this earlier, but it's actually been quite difficult to have the alternate perspective on this program because we live in a time where people are so afraid of conversation and of discussion, right? People are so stuck in their tribes and in their echo chambers that it's like, oh no, I can't platform this person, or I can't be platformed by this person, or I can't even interact with this person because they're on that side and my tribe has stuck this label on them, or the other way around. I think something that's so fascinating about what you're saying is there are a lot of people who perhaps might be closer to sharing my thoughts on the pandemic and the response to it in terms of the policies and so on, who are listening to what you're saying, and they're going to be thinking that from their perspective, when you're talking about actively harming people, or you're talking about spreading bad info or pushing bad science or whatever it is, there are many millions, if not billions of people, you know, it wouldn't surprise me if it's up to 1 billion people, who are thinking, hey, that's exactly what the powers that be did during this whole time period. This is what the media were doing. This is what the people who were pushing the, you know, pushing the vax mandates, pushing the lockdowns, pushing all of this. Like, you are actively harming people by doing all this. Because I mean, I do want to get into lockdowns. I want to get into mandates, but all of these things have consequences. Now, someone can argue that, hey, those consequences are worth it because we think that the potential upside is going to be worth it based on our risk analysis and our effectiveness analysis and so on. But the truth is, you know, people didn't, there wasn't sort of a view that all of society shared with this stuff. So again, this comes back to my opposition to mandates, right? So again, my position is not, hey, nobody should take the shot, or nobody should do this. No, and my thing has always been against It's been against the force. It's been against the coercion. It's been against the mandates. It's been against the infractions on people's civil liberties and basic human rights that we are, we were at least supposed to have prior to this time. I mean, the government telling you, hey, you can't go outside, or you can't go outside unless you put this thing on your face, or you can't go to school, or you can't go to work, or you can't do this or that, and you don't have equal rights unless you take these injections. To me, that's just very fundamentally wrong. I also think I don't just think it's a violation of the civil liberties, but I think even from a communication perspective and from a trust in the institutions perspective, I think that's like the worst way that you can go about this, because I think that what's happened now is trust in institutions has declined, and people are there saying, oh, why don't people trust us anymore? And it's like, well, because of everything you've done and said to them over the last couple of years. Like, if someone wants to convince me of something, I'm open to a conversation. I'm open to being convinced. I'm open to information. I'm open to looking at studies, looking at data, looking at stats. We may draw different conclusions on various things, but if it's just like, hey, do this thing because we told you to, and you know what, we're going to punish you if you don't do the thing. I think that's a truly awful way to communicate with. I don't think it's a good way to communicate with children, but I think it's a particularly terrible way to communicate with adults, especially when those adults are supposed to live in a free society. So with all that said, you're welcome to talk about some of that, but I really want to get into the lockdowns, and I want to get into both the mask mandates and the vax mandates as well. So I'm going to open the floor to you. You could respond to what I said, and you can also give your opinion on those.
Okay, sure. So, I mean, I think that when it comes to, like, I never did something because the government told me to do it. And I don't think that that's really what people should be doing. I think the correct thing to do is think, why am I doing this? Why am I wearing a mask? Why am I getting a vaccine? Why am I not interacting with people as much right now? Are there reasons for those things? And are they good reasons? Is there a benefit to all of these things that we're doing? I think that would be the way that I hope a layperson would look at it. So that's the angle that I want to come in at. Like,
can I ask you an honest question? Can I ask you an
Sure.
honest question? Do you think that is actually what happened in practice?
A
For
lot
the
of
most part?
people probably not, but I don't know. I don't know how most people think.
Wouldn't you say a good sign is that when the mask mandate was ended, for example, that like 90% of the people who were wearing them took them off immediately?
Oh, so I mean, yeah, that probably indicates that a lot of people were wearing them because they had to, but I still see a lot of people wearing masks today. Um, but
It's like
you know,
2% of what it was.
whatever the case may be, it's important to ask, why am I doing this? Like, what is the reason? That's what I care about. I care about the reasons behind the recommendations, the evidence behind them, that kind of thing.
Okay. Can I ask something? Because I don't want to assume your position, because I don't actually know this. But were you in favor of the mandates?
So the way that I view mandates, right? I usually answer this question by talking about childhood vaccine mandates. So before the pandemic, there was a study looking at childhood vaccine mandates across the states in the United States, because not every state has the same mandates for children to attend school, right? Some people can opt out just because of a philosophical belief. Some people have to have a religious exemption. Some people have to have a medical exemption. It varies state by state.
That's crazy to me, by the way, especially in the USA. Most countries aren't like that, but carry on.
Okay. But it was found that if you could only have a medical exemption, then vaccination rates were highest in those states, and those states were least likely to experience outbreaks of things like measles. In that situation, I think that makes sense. Cool. So let's go with the policies that bring us higher vaccination rates so we can prevent more measles outbreaks.
Do you not care about the civil liberties aspect here, or do you just think that the benefits trump that?
I think that someone's belief that a vaccine is bad should not influence the community. And when it comes to public health, it's not.
What exactly does that mean?
So if someone chooses, if a pocket of people choose to not get vaccinated and they bring an infectious disease into a community, then that can put other people in the community at risk.
But if those other people have been vaccinated, why are they at risk?
So not everybody can get vaccinated, and not everybody is going to be protected by the vaccine. Vaccines are not 100% effective, right? So nothing's 100% effective. So if those people are bringing infectious disease into the community and putting their neighbors, their friends, their families at risk, why would they do that? That doesn't make any sense. So
This is
when it comes
this is
to,
assuming,
like
but this
that
is
infringes on
assuming
my
that.
liberties at that point.
But this is where I think this sounds very nebulous to me.
How so?
Because, well, firstly, I think there's a conflation that goes on with someone being unvaccinated and someone having an illness. This is something that happened a lot again during the pandemic, right? It was the words unvaccinated and sick were almost somewhat interchangeably used by a lot of people in the pro-vaccine crowd. It was like assumed that, oh, well, if that person's unvaccinated, I mean, the logic didn't follow.
Yeah,
right.
so
The thing, in terms of many of the mandates, it wasn't like, okay, if you are sick, you cannot do X, or if you test positive, you cannot do X. It was like, if you are unvaccinated, you can't do X.
yeah,
And
yeah.
that's not logical.
Yeah, it's not like unvaccinated people are lepers. It's not.
Yeah, well,
It's not.
we were treated as such.
It's not. Well, I mean, it was those policies were in place at a time when a lot of people were dying of COVID. A lot of people were getting hospitalized. Hospitals were getting stressed, and because the hospital systems were getting so stressed, other people were dying of unrelated, like non-COVID causes. I mean, there
Yeah,
are.
but again, this comes back to the singling out of unvaccinated people, right? You could make the argument that, hey, like smokers are putting stress on the hospitals, obese people are putting stress on the hospitals, all these other people, but it was just like, nope, it was just this targeting of people who chose not to take this particular set of injections.
Sure, but when you can do something right now that puts you at a much better chance of not having a severe outcome of an infectious disease, and also reduces your risk of spreading that infectious disease. I know you probably disagree with that, but we can talk about that if you like. At a time when hospitals are so stressed and spread is so high, then it becomes a public health issue. And I totally, I think that smokers and people who live unhealthy lifestyles, sure, they can put stress on the hospital systems, but we also do have recommendations in place for those people to not do that. Doctors advise don't smoke. Doctors advise, try to stay healthy. And also those things are not infectious.
But if someone suggested that, obese people should be denied healthcare, or they shouldn't be allowed access to certain facilities, or as some countries did, they shouldn't even be allowed outside, I think people would very obviously see what's wrong with that. I think people would consider that a gross violation of human rights. So this comes back to my point of why I'm so opposed to these mandates. I do not think it was remotely justified.
Well, again, it comes back to this being an infectious disease, whereas obesity.
But you can still spread it if you get the shot.
You're at a reduced risk of spreading it.
Who cares? You can still spread it.
But you're at a
so the amount yeah, you can be at a reduced risk, but the idea that means you should be mandated to take it.
It's another reason to want as many people as possible to take it. Not only are you going to reduce the load of people suffering in the hospital and dying because of that disease, but you're also going to reduce the chances that those people who are vaccinated are going to pass it on when they do get infected, because that's the point of every vaccine. Every vaccine is, the main goal is to prevent severe disease and death. And if it prevents transmission, that's a bonus. but that is largely due to
Is that
the pathogen itself. It's not really, that doesn't have to do with the vaccine, but we can talk about
I
that
feel
if you
like
want.
I feel like that narrative on vaccines has changed with this most recent pandemic. Throughout my lifetime, most of the time, people talked about vaccines to prevent transmission and to
So
prevent
this is
infection.
this is a really big misunderstanding that a lot of people have.
Okay, go ahead.
And again, it comes down to the news. It comes down to this, the fact that there are so many topics, there's so much information in the world out there and so many topics, you cannot be an expert on everything. But experts in almost every topic are going to feel like their topic is misrepresented by non-experts, right? Because, and that makes sense. They know it better than anyone else. So when it comes to the scientific literature, when it comes to how vaccines have been written about in textbooks and in papers for decades, it's always been preventing severe disease, not that you're not going to get infected, because no vaccine is capable of preventing infection, right? And this comes down to like a cellular level, right? Like an infection is when the pathogen gets inside you and it gets into your cells. That's going to happen whether or not you're vaccinated, whether or not you're healthy. What's important is what happens next. There's also the factor of how much of the pathogen gets in. But if we're talking about just health here and medicine, then what happens next is going to depend on like whether or not you're vaccinated, how fast your immune system can kick into gear and control the infection, right? So like with measles or with polio is a good example. With polio, you get vaccinated, you can still get infected. Polio enters your body through your digestive system. It infects those cells. And the way you get paralytic polio is when it migrates to your central nervous system and then causes paralysis. That takes several days. Your immune system can kick into gear and control the infection before it gets to that point. That's why vaccination is effective at eliminating polio, the disease, but we still have polio, the virus, pretty much everywhere. The first time the CDC looked, and this is another criticism that I would make of the CDC, they don't look for polio in the sewage system. That's where you would find it if people are infected with it and they're shedding it into the environment. They don't look for it. But when they did a few years ago, when there was a case in Rockland County, New York, they found polio in the sewer system. Same with London. London looked in their sewer system, they find polio. Polio's there. It's just not making people sick because they're getting vaccinated. So vaccines always have been a tool to prevent severe disease and death. And preventing transmission is a bonus, but it has to be, in order to prevent transmission, your immune system has to get into gear before you become infectious. And that's going to vary from pathogen to pathogen. Vaccines are really good at preventing spread of measles because you're typically not infectious until you get your rash. And that's like on the order of 10 to 12 days after infection. But with something like influenza or SARS-CoV-2, you can be infectious within a couple of days. And so vaccines can kick into gear in time to reduce your period of shedding virus or reduce your total viral load. But it's not going to be as effective at stopping transmission as some other vaccines. But it does reduce it. So
how much does it reduce it by? How much does it reduce transmission by?
I can get you a paper that looked at the numbers, but it significantly reduces your viral load and it reduces your window of infectious shedding by on the order of days. So
okay. So here's another one where so-called conspiracy theorists question big pharma, question bureaucrats, question policies. Why was naturally acquired immunity ignored? Why was the shot pushed on people who had already had COVID and fully recovered from it and even had tested positive for antibodies? What was going on there?
Because it was shown that having a shot on top of your natural immunity, which some people like to call it infection granted immunity or something along those lines, but we'll call it natural immunity. Having one vaccine dose on top of that really improved your immunity. So in the literature,
where do you get? I do want to ask. Okay, sorry. Answer this question, and then I've got a more general question I want to ask.
Oh, okay, sure. So natural immunity was not ignored in the scientific literature. In 2021, we knew this as early as like mid 2021 that if you are infected and you get just one dose of vaccine on top of your infection, then your immunity looks better than if you had 2 doses of vaccine. It looks more like what we recognize now as having 3 doses of vaccine, right? And the way we look at that is we look at how broad your antibodies' abilities are to attack and neutralize virus. So that means, like, are your antibodies able to neutralize Delta and Omicron and all these other variants? That's what we mean by broad antibody immunity. And it also broadens your T cell immunity, which is different. T cells work differently than antibodies, and they are a lot less prone to being evaded by variants. T cells are harder to fool than antibodies are. So it was known from 2021 on that getting 1 dose of vaccine really improved and broadened your immunity, which again goes back to, if it's better, if it makes you safer, then why not do it? And so now the CDC recommendations are that everybody, regardless of previous vaccination status or infection status, the recommendation moving forward is just to get 1 dose of mRNA vaccine, because they assume that most people have been infected by now or gotten vaccinated by now, and 1 dose of updated mRNA vaccine, according to literature that we knew in 2021, is going to give you substantially broad immunity and give you really good protection relative to not getting it.
Okay, I've got two follow-up questions on this, man. Like, I know with time we'll probably need to do a follow-up on this at some point.
Sure.
But so it's interesting, you know, hearing all of this, because my brain keeps going to, even if, you know, I have questions about various things, right? But even if everything that you're saying were correct and true, let's say we're talking about someone who is 25 years old, and their original risk of, if they get COVID, you know, their chance of death, let's say, is 0.002. And let's say they've already had an infection, they've already got, and I mean, it's like the risk is already so low in certain cohorts that reducing the risk even further, like, even if someone could convince me that, you know, I could reduce my risk from 0.005 to 0.003, you know, to me, it gets a bit asinine, right? I'm not talking about elderly people, but I'm talking about the younger cohorts and demographics. I'm just like, what is even going on here? Especially when you consider, again, especially if you're talking about mandates and you're talking about the infringement of liberties, especially if you're talking about lockdowns, you're talking about masks, you're talking about all of these other things which have consequences for people. These have social consequences, they have economic consequences, they have mental well-being consequences, they have a lot of consequences. So to do all of this, like, if we were talking about, okay, look, there's this virus, and hey, if you get it, there's like a 20% chance it's going to kill you. And here's something we can do to reduce it from 20 to 1. Here's something we can do to reduce it from 20 to, you know, even down to 5. Like, to me, that's, again, I'd still be anti-mandate, and I don't think a mandate would be necessary, because I think if you gave people information, they would, you know, do what makes sense. But for a lot of people, I know I can say this confidently, for a huge amount of people, it's simply that the risk is already so low, and always has been, that reducing the risk even further while potentially, especially at the time when, you know, all of this was rolling out and a lot of these, you know, long-term consequences are not known, how effective it is not known, how long it's going to last is not known, right? They started rolling out the boosters and all that. A lot of people are just like, you know what, like the math doesn't make sense for me. And by the way, this is one of the main reasons why, again, I myself in my personal life and even publicly, I never told anyone what to do. I didn't tell anyone, hey, like, go get the shot, go get, like, one person here is a 15-year-old who's perfectly healthy. Someone else is a 75-year-old who's got, you know, multiple health issues and so on. Like the math is not the same. The math isn't the same for myself and, you know, for, you know, a grandparent or an old uncle or something. And again, this comes back to why it's just like, it should be a personal choice, especially when you get into the fact that I know that vax side effects might be, you know, again, depending on who you talk to, some people think side effects are extremely rare. Some people think side effects are pretty common and very severe, but regardless, there is another risk that's being introduced from that. I do personally know people. I do personally know two young men who did have myocarditis post shot. Like, you know, they both actually, more than that, they both had heart attacks. Like I do know that definitely happened. And I know that, you know, sometimes people don't want to talk about that because people have their different sides, right? You'll have people who don't want to admit that some people have had a nasty time with the virus. And you have other people who don't want to admit that some people have had a nasty time with the shot. And it's just like, look, it's all true. There's all sorts of different risk analyses out there. And that's why I think ultimately it should and always should have been left up to the individual and I'd even say familial choice, right? I don't know everyone's different situation. I don't know who's been infected and who hasn't. I don't know what comorbidities people have or what they don't. I don't know how old everyone is and their entire medical history. And I'm not interested to know either. But I think like with most other things, like with flu shots, I think it should just be like, hey, it's here's the information, here's the availability, and it's up to you. Here's who we recommend it for in particular. You know, and here are the numbers. And I think, again, I think in a free society, that's to me, it's like, that's obviously how it should be done.
Okay. So let me go back to this idea that, you know, there's such low risk associated. Why do I want to reduce an already low risk? So when it came to a disease like polio, do you know about, you know, what percentage of people died from polio? Kids?
Not off the top of my head, no.
Do you have an idea?
No, I'd just be throwing out a random number if I did.
Okay. It was around 0.1% of kids died of polio. But because it was such an infectious disease, in places like India, at peak points of polio being endemic there, there were about 5,000 children. I'm gonna be more conservative and say 1,000 because I don't remember the actual number. I remember the paper, but on the order of 1,000 children being paralyzed a day, and your risk of paralysis is also low when it comes to polio infection. It's about 1%, and that's a significant number. So even with a low, seemingly absolute risk, it can have a huge net effect when it comes to the community. And again, you can't necessarily predict who's going to have a hard time with it, who's going to have those outcomes. So when it comes to recommendations, you know, those had to be made broadly in order to have a good public health impact. And the same is true with COVID. With COVID vaccines, you know, I say this, and I think medical doctors agree. When it comes to public health in general, you know, we don't look at suffering and say that's acceptable. In any case, you know, we don't look at a 0.005 risk of dying or having another adverse outcome of COVID in a healthy 15-year-old and say that's acceptable. Sure, no one cares. Just similar to, we don't look at the confirmed risk of myocarditis after mRNA vaccines and say, yeah, that's acceptable. Who cares? In neither case was it acceptable. So we do things about it. So in the case of COVID, for that healthy 15-year-old, we say, what can we do to reduce this risk? So we run large scale trials in people that age to see, does COVID vaccination reduce risk of hospitalization or ICU admission or death? And are they safe?
Sorry, Dan, I hate to cut you off here, but
sure.
The reason I can't buy this argument is because so many of the policies that they put in place had such an obvious and predictable negative impact on young people, right? Whether we're talking lockdowns, pulling people out of school for 2 years, forcing kids to wear masks and not be able to touch their friends and hug their family members, like all of that stuff.
So I'm talking about vaccines right now. If we want to,
yeah, I just don't think my point is that it's not univariate, right? It's not just like,
sure,
it's
but
vaccine or not. It's like the whole. Carry on.
Sure, but we look at the total risk benefit. We don't look at it narrowly like that. And the same is true with vaccines. Like when it was confirmed that myocarditis is a rare side effect of mRNA vaccination, we said, okay, how serious is this and how do we reduce this risk? And action was taken on that. There were several recommendations put in place to reduce that risk. And there was also a lot of work done to understand what that risk was. And both of those things in order, what was done was it was noticed that there was a slightly higher risk with Moderna rather than Pfizer. So there was a preferential recommendation in adolescent boys, which were the high risk group, to get Pfizer instead of Moderna. It was also noticed that if you have a longer waiting period between your first dose and your second dose, your risk of myocarditis goes way down. And that's actually better for immunological reasons, to wait longer between your first prime and your first boost when it comes to vaccinations. So at least in this case for COVID, it was that way. So those recommendations were made and myocarditis risk was reduced that way. And we also overall reduce our risk of severe outcomes by COVID when we vaccinate. And that includes myocarditis. When people are vaccinated against COVID, they reduce their risk of myocarditis from COVID, and the risk of myocarditis is much smaller than, it is still overall much smaller than the total risk that they're exposed to if they get vaccinated and then infected.
Do you think it's unreasonable for an 18-year-old, a 20-year-old, a 30-year-old to, let's say in 2021 or 2022, to just look at all this and even have all of these numbers that we've been going through and spitting out and just decide, you know what, I don't want or need this shot? I mean, is that an unreasonable, do you think that's an unreasonable conclusion for
that's fine.
Someone to risk?
I mean, that's fine. I think that I don't agree with it. I don't think it makes sense to choose a path that is incurring more risk on yourself. But if that person just said, I don't want it, my reaction would be, well, okay, why don't you want it? Are you worried about something? Like, let's talk through this. And if I talk through it with them and they still say, I hear you, I understand, but I just don't want it, I'm like, that's cool, man. Whatever. As long as you aren't making an uninformed choice and you're not being swayed or scared by the claims that I see flying around on Twitter daily, then that's fine.
Why couldn't that have, again, my point is, if that had been the general approach, there never would have been all of this drama.
I don't
right?
think
There wouldn't have been. It was literally the mandate that people had an issue with. I mean, I remember, at least in the at least in the UK, but as far as I know with the US, let's say it was from about December 2020 when they really started rolling out the shots, and they were prioritizing people, I think, who were over the age of like 70 or 65 or something. People generally didn't have a problem with that. It was when it got to the point of mandates and coercion and discrimination and segregation and pushing it on children and forcing them to take it to go to school, university, or whatever. That's when people, as far as I'm concerned, very rightfully so, got up in arms, because at that point it's like, wait, what's going on here? Are you just trying to sell more shots and make more billions of dollars? This is when people start thinking of ulterior motives, right? Not everyone who got labeled an anti-vaxxer thinks that, you know, the shot itself is some sort of like bioweapon, or it's gonna kill people with 5G, or like whatever the stuff that's out there. Like I never said any of that stuff. Like that was never any of my position. My position is just like, look, man, we're supposed to live in a free society. Like there are so many medicines and treatments and surgeries and things that exist out there in this world, thousands and thousands, maybe millions. I imagine, you know, both of us, like, we don't take 99.9% of them. Like I have no interest in going on chemotherapy. It doesn't mean I'm against chemotherapy. I don't need it. There might be other people who do, and it's beneficial to them. And if they want it, then that should be their choice. I don't think people should be forced to take chemo, but I think it should be available to those who want it. I don't think everyone needs to take. I take hay fever tablets in the summer because I have hay fever, but a lot of people don't have hay fever and they don't need to take it. And hey, there might be people who have hay fever and they don't want to take the tablets. And I might be like, oh, hey man, like, you know, a Claritin tablet's not going to hurt you. And they might be like, yeah, you know what? I just don't want to take anything. And I'm like, okay, cool. Like, that's your right. Again, it just, to me, the whole thing really, really came down to the mandates. It came down to the coercion. And I think part of the reasons why it's so hard and why it's been so hard for these type of conversations to take place, besides the censorship, has just been that fundamental issue. Because I think it's a matter of ethics and sort of moral and sociocultural political positions in terms of the mandates, right? There's people who think that, look, a mandate is justified because you know, we looked at the numbers and we think it's going to do X. And then there are people who are just very fundamentally and strongly and staunchly opposed to the idea that the government or bureaucrats or scientists have a right to tell them what they must inject into their body. My position is like, look, give people true and honest information. Let the conversations happen. Let each side prevent itself. Let people share their opinions openly, whether they're crazy or whether they're totally reasonable. And people will do the things that make sense. Like I've said before, like, look, if there were, if I believed that there was like let me just give a scenario here. If there were like some virus that were going out there, just sweeping through the population, young and old, and it was like killing 20, 30, 40, 50% of people, whatever it is, you know, some type of airborne Ebola or something. And someone like, and someone made a vaccine that was like genuinely safe and effective. It's like, okay, cool. Like, this is going to reduce your chance from 30% of death down to like 0.1. And there's like very few, if any, side effects. Like, you don't need to mandate that. You don't need to coerce it. Like, people will just be like, cool, line me up. But this is just not what the math was on this one. And that's why myself and many others were just like, wait, the math is not mathing here for me.
So I think that there was going to be drama either way. I think whether or not there were mandates, people were going to not want to take, a lot of people were going to not want to take this.
I don't think that people not wanting to take it is drama.
Well, that's the drama we're talking about, right? Like, saying,
no, I'm actually talking about the polarization. I'm talking about this vaccinated versus unvaccinated battle that started happening in all these different countries. I'm talking about the discrimination. I'm talking about the segregation. I'm talking about the massive protests and the convoys and people like fighting in the, like, you know, you were kind of on the other side of the issue, so I don't know how much of it like you saw, but from country to country. Okay, you saw it, right? Like, all of that stuff and all of the resentment that now exists and lack of trust that exists now in our societies between citizens, and also between citizens and institutions, I think all of that could have been completely avoided just with clear, honest communication. I have no
So
problem with guidelines. I have no problem with recommendations even. It's simply when you're making laws or making mandates that are discriminating against people based on their medical status, I think that's fundamentally ethically wrong.
I so I think that there was going to be a lot of resistance either way. Um, and again, when it comes to infectious disease, it's not just one person that we're talking about here. I mean, this has been the history of public health. Like, you could go back to the times of early 1900s and smallpox, when it was actually like super unethical. A lot of the vaccine mandates, because at that time, a lot of the people who had smallpox were immigrants, so uh, people from Europe, people from China, people from Mexico, black people, like that. They were the ones who were oftentimes more likely to get smallpox because they were living in more crowded areas of the city. And when there was an outbreak or a case of smallpox, they would literally come with police and vaccinate the person at gunpoint if they refused, because it did genuinely pose a significant health risk to the community. But also, yeah, it's kind of fucked up that they did that, you know? So I'm not defending the mandates. I'm saying that if people are choosing not to get vaccinated because of the mandates, I don't really know. I don't really understand where they're coming from. To me, it's kind of lazy thinking, because
Oh,
and the
sorry.
thing and the
Sorry.
thing is,
Can you say what I didn't quite understand something you said there. You
yeah.
said if people are choosing to not get vaccinated because of the mandates. What do you mean by that?
So if there's a mandate and someone just says, this mandate seems fishy, I don't know why they're mandating this. This is making me question things. I'm going to not get vaccinated.
Okay,
I think that
I don't think that was many people's thought process.
right. I think most people made the decision to not get vaccinated because of some fear or hesitancy that they had around the vaccine, or they didn't think that they
I
needed
think
it.
most people, yeah, I was going to say, I just think most people just didn't think that they needed it.
But I do talk to a lot of people who not only just don't think they need it, but also think that it's harmful, that it's poison, that it's going to hurt them if they get it, that they'll take their chances with the virus. And, you know, it, from your perspective, like, that is their choice, that they have their right to, they have their right to choose that now. Back in 2021, early 2022, when the pandemic was having much more of an impact and those mandates were in effect, whether we agree with the mandates or not, I personally don't care for them. I just care about, why are people not choosing to get vaccinated? Um, it was a different story back then, whether you agree with the mandates or not. But now it's their choice. And usually their reasoning is what I'm interested in. And their reasoning is almost always rooted in something that is just totally incorrect. Something that they heard the news say, something that they read
I don't.
online, something
I'll
that
be
is,
honest, man. I don't think that is. I don't think that that's a fair assessment.
well, I mean,
I don't
so
think that's a fair assessment. I know that there are people like that, but I don't think that's the position of the majority of people who chose not to take the shot. I believe that the main reasons were, number one, I don't want it or I don't need it. A lot of people, prior infections, a lot of people in the age demographics where it's like they look at the numbers and they're like, okay, the chance of me, having a rough time with this is well below 1%. So, and I take care of my health in other ways. So I'm fine. There was definitely mistrust around the media, the politicians, the bureaucrats, the public health experts, and so on, who were pushing it. And I would say that a lot of that skepticism is justified because they got a lot of things wrong. They lied a lot. A lot of it is also just the fact that it was such a new thing, right? Again, you've talked about polio, you've talked about measles, you've talked about things that we've been aware of our entire lifetimes. But in this situation, it was like, okay, this virus has been out there for under 1 year, and this thing is now being pushed. And I don't think it's an irrational position for someone to take, to be like, wait, hang on. I mean, you could take something that's way less severe. Someone could invent like a brand new type of car, or a brand new smartphone, or a brand new laptop, or a brand new camera. I probably don't want the first version. I'll probably just be like, you know what? Like, let other people test it. I don't know how good it is. I don't know how reliable it is. I don't know whatever, let alone something that you are actually injecting into your own body. I don't think that that is an irrational perspective. Just like I don't think it's irrational for someone who's genuinely at high risk of the virus to be like, you know what? I don't care if it's not like, I don't care if we don't have years and years of studies line me up because I'm so scared about this virus. I don't personally think that that's an irrational perspective. I just think, people do very different risk analysis. For someone might hear 0.01% risk and think, okay, I need to mitigate that. And someone else hears 0.01% risk and they're like, cool, like whatever, like that doesn't even, to them, it sounds like zero. Like it doesn't even register for them.
Sure. So, but you started saying, like, you start expressing this concern about how long the vaccine has been out, and that's the kind of thing I'm talking about. Like, that is an incorrect way to look at it. It's not an
Okay, tell me
informed
why.
way to think about it. So
Okay, tell me why.
when it comes to vaccines, it's not about how long they've been out, because vaccines do not cause problems 6 months, a year, 5 years down the road. That doesn't happen. Vaccines are going to cause adverse events within the first 8 weeks of when the dose is given. That is the history of vaccinology and adverse events. So what we worry about with vaccines is not how long they've been out. It's how many doses have we given, because it's the rare side effects that we want to pick up on and understand. And you're not going to see rare side effects until at least 1 million people take them. And in the case of COVID vaccines,
but in the terms of like the way people's brains actually work, there isn't much of a difference between those things in the way people process things.
Well,
does that make sense?
With COVID vaccines, there were over 1 million doses being given a day in early 2020 or early 2021. And so it was really clear really early on that the safety profile was extremely good. So still having that fear of long-term effects, like something happening to me a year from now if I get this vaccine, that's not correct. That's not rooted in any basis. It's
okay.
It might not be irrational to think that, but it's not rooted in any basis, right?
What about effect? Okay. I'm happy. I hear that point.
Right. And so, like, that's, you were talking about if people just had clear and open information. The frustrating thing to me as a scientist is that information exists. That information is out there. People just don't listen. But it's not just that people don't listen. It's that news media and popular podcast hosts don't know how to accurately assess the scientific literature. And it's not entirely their fault. Scientific literature is not written for the average person. When I wrote my thesis, I read the abstract after toiling over and slaving over each word. I read it and I'm like, man, like only like a couple hundred people in the world are ever going to understand this shit. Like this is not written for the average person. And I couldn't figure out a way to change it. It's just the way that scientific literature is, because we write scientific literature for our colleagues to read it so that they can understand it and then build upon that work. Right? So it takes a lot of work to take science and make it digestible, and too few good science communicators or scientists who know how to communicate put in the effort to make that information accessible, right? But the information is always there. I can give you an example, and we're kind of getting to the end of our time here. I have to go meet my wife to pick up our kids soon, but there's a really good podcast that I like to listen to, and I like to listen to it because it feels like I'm listening to a journal club. Like in grad school, when I was getting my PhD, we had these things called journal clubs where everybody would read a paper, and then we would get together and discuss it. And that's kind of what this podcast is. It's called This Week in Virology. It's run by virologists. There's an immunologist, a parasitologist, and their guests are a wide variety of scientific backgrounds. And they just talk about papers, and they talked a lot about COVID too. And back in 2021, when vaccines were rolling out, they accurately reported on COVID vaccines and what we could expect from them. They were very honest in saying, like, these vaccines what are our goals here? Our goals are to prevent severe disease and death. And what's the efficacy so far in the clinical trials of them preventing infection? It's this, but they didn't measure asymptomatic infection, and so those because of waning antibodies, which we know exist, those numbers are going to go down. But the goal is to remain severe disease and death. They talked about all of that. It was very clear, but their podcast is not very popular in the grand scheme of the podcast landscape. Mm-hmm. They're a popular science podcast, but they're not huge. So, I wanted to give you a challenge. I could pick 5 episodes for you, or you could just listen to 5 random episodes. If you're interested in this topic, just pick 5 random episodes and just listen to them talk, because I think that gives a good insight into how scientists think about these problems and talk through them when they're reading data. So I wanted to offer that to you and maybe some of your listeners.
Yeah, that's that's all good, man. That's totally fine. I'm not unwilling to or afraid to listen to anything or expand my perspective or learn. Again, what bothers me is, I guess I wish that the people who had communicated the quote unquote science or communicated the public policy, all of the communication through this thing was awful. Like it was truly terrible, because if the goal was to inform people so that they can make informed decisions and base it on science, again, I don't think the way to do that is to just come out and, number one, lie, number two, like threaten people and coerce people and, insult people, call them names and so on. Like, I'm not saying that, like, I'm not talking about you here. I'm talking about like lots of these politicians and bureaucrats and people in the media and so on. It's just like, this is not, if the goal here is to change people's minds, right? If you genuinely think that someone's got like wrong info about whether it's the mask or whether it's vax or whether it's this or that, like, the way to change their mind is not to just, like, I don't know, call them dumb and dismiss them and label everybody an anti-vaxxer and say that they want people to die and this and that. It's just like, as someone who communicates for a living, it's just like, this is not, regardless of your perspective, this is not good. This is not good communication. Maybe like, I haven't listened to this podcast yet, but it could be the case that I wouldn't be surprised if I listened to it and I'm like, oh, like, they should have let these people, run the communication for whether it's the CDC or like whoever does it in all these different countries, because like the spokespeople were not good and they were not honest.
I can agree. The spokespeople were not great. I would also say they had a really tough job. But yeah, I agree that they weren't great. And what was I going to say? Shoot, I lost it.
That's all.
No, it's gone. It's gone. I lost it.
No, it's okay, man, dude. I know you got to run, Dan. I appreciate you. I appreciate you taking the time. Like I said, this conversation was long overdue.
I'm sorry.
You found it?
I just remembered. Yeah, when it comes to communicating with people, my personal goal. Like when I first started my channel, having been someone who used to believe a ton of conspiracy theories, I came into it like, I'm going to be super patient with people. I'm going to talk through people. I'm maybe going to have like a few hundred subscribers on this channel ever. So I'm just going to make it my little hobby to like talk to people when I'm free. But now, you know, I've dealt with people who are wholly dishonest. And so what I try to do is I try to figure out what their motive is, who they are coming into this conversation. Are they here just to try to like mine content off of me, or try to are they actually trying to learn, right? And sometimes it's easy to tell, sometimes it's not. But the point is, I think there's a place for you know, both kinds of communication. And I'm not talking about like our communicators in public health, that I'm not saying what they should do. I'm saying me personally. Like if someone comes to me and says viruses don't exist and COVID vaccines have killed 17 million people, I'm going to say that is dumb. I'm going to say that's really dumb, man. And if they're honest, if they're honestly willing to learn, I'll talk through them with it. But a lot of these people that I've encountered, and they're not all like this, but a lot of these people that I've encountered are not willing to learn. And so sometimes some harsher communication ends up happening. And I'm not saying that's a good thing. It just happens sometimes. And I think
it's a human thing, man, dude.
I think there is a place for like, you know, if someone comes up and says that and you just are not gentle with them, then maybe, you know, they're probably not going to change their minds. My goal at that point is not to change their mind. My goal is to help listeners learn something. Because I remember when I was young and impressionable and falling for a lot of this stuff, if I had heard an interaction like that where I realized, oh, this person doesn't know what they're talking about, then that would have helped me. So anyway, I just wanted to say that about,
Yeah, no, it's all good, man. I know you got to run soon. I do have one question. It's not about COVID or anything, but
sure.
I'm curious. I don't normally ask this at the end of podcasts, but given how we came into this one, I think it's interesting. How did this conversation go compared to what your expectations and perhaps presumptions were?
I think it went about as I would expect, honestly. I mean, I know that you're not a super confrontational guy. I know you're not one to, like you said at the beginning, debate and treat your guests a certain way. So I think, and I knew you were going to bring up things that, you know, I disagree with and that I hoped to kind of correct with my perspective and the information that I've come to understand over the years. So yeah, I think it went about as expected, and overall pleasant, you know.
Good. Awesome, man.
And
sweet. No doubt, man. There's a lot that we didn't touch on, so maybe we'll do another one of these in the future. Everyone listening, I hope that, you know, whoever you agree more with, or whatever position you've taken throughout this last few years, or whatever position you're in now, I hope that everyone's just been able to expand their mind and expand their perspective a bit, and also to understand that these conversations are possible. I think a lot of people think it's completely impossible at this stage, but it can be done and it should be done. So Dan, thanks for spending the time to come on the show. I appreciate it and I respect that.
Thanks, Zuby.